Hello again, everybody. It's Lori White, president of the Greater Providence Chamber of Commerce, back again with another edition of Chamber TV. This is episode number 179, and our guest today is Eric Swain, and Eric is vice president of United Healthcare of New England. Eric, how are you today?
I'm doing well, Art. Good morning.
Good morning. Fantastic. Thanks for being with us. This is a great opportunity to catch up with you and the whole team at United Healthcare. It's been a bit since we've had an opportunity to sit with you and talk about some of the issues that you see, big picture perspective around healthcare utilization, rate structure, cost, everything that's going on in the market with the hospital and healthcare community. So really excited to get right to it.
Always a lot going on in healthcare, and yeah, thanks so much for having me.
Sure. So United Healthcare, very prominent member of the Greater Providence Chamber of Commerce for a very long time. Really excited to be able to see you today, Eric, to catch up. So give us a sense as to what's happening in the building. Everybody is quite familiar with your location right off of 95 near the airport. If you're heading north, it's to the right. Beautiful
Yeah.
building, beautiful piece of real estate, lots of employee headcount, and making a very important contribution to the economic base of the state. So, catch us up on what's happening, Eric.
Sure. Yeah, a lot going on since we probably last spoke. A lot's happened in healthcare. From our standpoint, you talk about the building. We actually have two offices here in Rhode Island. I sit in Warwick. We have about 450 employees that sit here in Rhode Island, all focused on our corporate mission of helping people live healthier lives. Have a long history of doing that in Rhode Island. Like, as I mentioned, our employees, they live here, we work here. We're part of a big national company, but we realize that healthcare and the ability to deliver on that mission of helping people really happens at the local level. And that's where it starts, because healthcare is really very local.
Where is the location? So you mentioned Warwick, a second location with, I imagine, another 400 in headcount.
Actually, about 450 in total in Rhode Island, and yeah, through the two offices. And it's we've seen Rhode Island and New England really begin to expand from a growth perspective. There's a lot going on throughout the country with healthcare. Our goal is to you know take our big national strength and ability, innovate nationally and deliver it at the local level, as we're doing here in Rhode Island.
Yeah. So you just said something very important. We're seeing
Yeah.
Rhode Island and all of New England starting to expand. So I guess you mean expand economically, continue to add jobs, continue to grow the revenue base. What are you seeing specifically?
We do see an expansion. We see a bounce back with the economy. Obviously, like we went through a lot with COVID. Everybody went through a lot. The healthcare industry was heavily impacted. We have seen that economy come back. We've seen our the employers that we're working with. We see them hiring more employees. I think when it comes to healthcare, something interesting we saw as a result of the pandemic was employers, as we began to kind of come out of that COVID, employers were looking to actually increase their benefits. And I think it's a function of, COVID really underscored how important healthcare and health was to all of us. But employers came back with this idea that healthcare wasn't just something they had to offer as part of the checklist. It was really an integral part of employee benefits, and they saw it as really important to delivering better care, things that would help improve their health, things that were changing in their lives that they wanted to support. Maybe it was elder care or adoption services or things like that. Things that hadn't been part of employee benefits in the past all of a sudden became a big part of employee benefits. Probably the biggest example of that was behavioral health. Right, behavioral health has always been important. We've always had a focus on it, but the COVID pandemic really underscored, and I think taught people that it was okay to address that issue for themselves, and it brought a lot of people forward who probably needed care and weren't getting it or didn't know how to get it. And it allowed them a much better forum to raise their hand and say, yeah, I do need some help with anxiety or depression. So, we're seeing, what we do in healthcare really expand in terms of how we're touching people and how we're engaging them.
Yeah, thank you for bringing that up. I think that's a fascinating point, and a lot of employers are, in fact, sharing this notion that their employees are looking to them to be problem solvers, to be the leaders, to be able to be in a position to address very difficult global issues. So the relationship between the employee and the employer, I think, has only gotten stronger and a lot stronger over the course of the last 3 years as a lot of these existential crises, if you will, rear their heads. Is that what you're seeing as well?
Yeah, and it's the connection of healthcare, right? Healthcare isn't just about, I sprained my ankle or I have a chronic disease. Healthcare became so much more about an employee's health in all angles. Like I said, we talked about behavioral health, and we talk about the things that were going on around them that also impacted their health. So that's where we saw employers really begin to focus. It wasn't just what's your deductible, what's your co-insurance, what's your copay. It really became about what things can we offer to their employees to help them with their overall health. And that's I think an exciting part because it's all so interrelated. And I think it's one of the things that we do very well is we try to integrate everything as much as we can. So we're able to work with a member on their health care, but we're also working with them on all the other things that are touching their potential health. Whether we talk about behavioral health, it might be dental insurance, it might be disability insurance, or any number of things that all impact their overall health.
Mhm. And again, are you seeing incidences where it's a difficult market to recruit employees? There's a lot of folks that have withdrawn from the market. They're thinking of new careers. They're reevaluating their own profession, looking potentially to go to other places. So, from an employer perspective, the ability to be able to, as you point out, have a very robust, different, interesting, innovative healthcare benefit package on top of other employee benefits, and certainly the degree of flexibility. We're hearing, a tremendous amount of that in terms of being able to feel the workforce and employees saying, yeah, but what about my options? What about, can I work remotely a couple of days a week? Oh, and on a broader perspective, let's think about what you are as a company. Do I actually want to work for you? What are you doing, to protect the planet? What are you doing from an environmental sustainability point of view? So there are so many new touch points in this whole dynamic of, compensation and benefit package and sense of purpose.
Yeah, Lori, so you hit the nail on the head. So much going on, right? And we could unpack what you just kind of asked in about 8 hours. Um, First thing is, yes, different workforce, right? So people are no longer sitting in office all the time, and that changes everything. And certainly for us, it changes everything. So you might have an employer in Rhode Island, all of a sudden it's hiring people in California or New Mexico or Texas or wherever. And so care is no longer just about where you sit. Care is about where you are, where all your employees are, and where they may go and where they can go. One of the things we do very well is we kind of saw that, and we're completely seamless across the country. It doesn't matter where employees sit in all 50 states. We've got them covered wherever they are, and that's a big change that we saw, is that confinement of the office no longer exists. And it came down to little things we're experiencing right now. If you look 5 years ago, most employers during open enrollment would hold open enrollment meetings, and all the employees would pack into the cafeteria or pack into a conference room, and they'd invite people like us in to talk about healthcare and what it was. And we, print paper and hand it out, and people would ask questions. That no longer exists. Now we need to get to them in a very different way. We need to get to them in a digital way. We're not printing paper anymore. We're sending out digital information. We're changing the way that we communicate with employees too, because when you think about it, employees would go to a session like that and maybe learn about healthcare, but they really weren't listening to what was available to them, because most people don't really want to, they don't want to know about healthcare until they need it. But when they need it, we kind of figured out we need to get to them in a better way. When they need it, that's when we need to tell them what the information is. So we're changing the way we work with people to help educate them, and we're doing it more of an on-demand basis. And I'll give you kind of an example where, you know, years ago we had this great program for people that developed cancer, and we, during an open enrollment meeting, we talk about it, and if they have cancer, we had people that could help them through and help them with all sorts of areas get better care and get to the best places where they get the best care. And we talk about it during open enrollment, but most people sitting in an open enrollment meeting wouldn't listen, because if they didn't have cancer, oh, sorry, that's my lights. I'm gonna let that go. Most people, wouldn't listen to that because they didn't have cancer at the time. Our goal is when someone is diagnosed with a cancer, that's when we need to get to them, right? That's when we need to help them understand what's available to them. And that's what we're doing. We're using things like artificial intelligence. So when people call us, we can see that diagnosis, know we need to get them to a specialized cancer unit that answers that call. We don't care why they're calling us. But they may be calling to say, I need a new ID card. We'll get them that ID card. But when we have them on the line is when we'll try to engage them. So it really changed from this, how do we educate people up front, to how do we educate people when they need it and when they need us?
Yeah,
So
I think
a lot going on.
yeah. So I think it's probably human nature. You don't want to think about cancer if you don't have it, because you're hoping you don't get it. And if you don't think about it, then maybe it won't happen, right? So
Right. And we're doing that with, and I use cancer as an example. We're doing that with almost everything. So how do we get to people when they need that care and educate them then? So yeah, it's across the board, and you've had such success. We're doing it with more and more diseases and more things that we want to engage with members about.
yeah, so you touch on something interesting. You have a repository of data, huge repository of data and trends and bending the cost curve and the like. So the question is, do you think people are generally healthier by having, the experience of working remotely, working from home? Are there any trends that you have seen as a result? Discounting COVID itself as an illness, but anything that you're seeing in the data that would be interesting to share?
Tough question of, are people healthier? I think, well, I'll tell you, I certainly was. I took the time to exercise more during the pandemic. During that short period of time we were at home, it was a lot easier to get your exercise in. So I think, yes, I think a lot of people, you look at the explosion of Peloton. So I think, I think people took an advantage of some of those things to be healthier. And it brought health more to the forefront. I think one of the exciting things is, during the pandemic, people sought care in a different way. And obviously the explosion of virtual care, the idea that you could get care delivered on a phone or on a computer, that was really, really small before the pandemic. You had very few people that were doing it. Once in a while, someone would go in there and try it out for, pink eye or something like that. During the pandemic, you saw that was the only way people could get care. So you saw an explosion of virtual care happen, which is really exciting. And the exciting part of that to me, and how that relates back to is it improving care, is the idea that you can, we're really expanding access to care for people, right? Not everybody has a PCP. Not everybody goes to the doctor when they should go to the doctor. Not everybody knows where to go when they need it. And virtual care is really beginning to kind of break down some of those barriers, right? The idea that you can, call a provider from your living room and get something done that you might have kind of put off or not done it. But that's, that's kind of where it is now. Where it can go is, I think, so much more exciting. How we can treat people with chronic conditions that maybe aren't treating themselves the way they should. They're not seeing the doctor on a regular basis. All of a sudden, we can get to them in a much easier way. We have a virtual care program that actually uses our own providers. So these are United Health Group providers that are providing that virtual care. And so the exciting part of that is when a member calls us, it's not a random person talking to a random doctor and taking care of a condition. That person calls us, and the doctor that answers the phone now has access to all of our information and has access to every touch point that member has had with the healthcare system. we can see if that member has not filled a prescription recently, if they've been to the emergency room 5 times and don't seem to have a primary care doctor to engage with. The doctor on the phone can see that and close those gaps in care. And actually, we have a program now where that doctor can become that member's primary care doctor. And that is such an important thing. Is primary care, having a good primary care doctor for every member is so important for a member's health. And the other thing that's kind of neat, and this became big on the behavioral health side with virtual care, is whether it's medical care or behavioral care being delivered. When you think of what happened in the past, these members are showing up at the doctor's office, and the doctor's view of them is what they presented in front of them. Now the doctor's getting a little glimpse into what's going behind them at home, and are they living in difficult conditions? So it gives kind of different perspectives sometimes on how we can engage with a member and see what's going on at home, and maybe what are the things that are leading to some of their conditions. So a lot of really exciting things going on with virtual care, how people get that care, and I think it's going to really continue to improve not only the access but the quality of care that people get. So I think that's really exciting, and we're seeing it with it's primary care. We're developing more specialty care, so things like dermatology and chronic disease management for members that haven't been taking care of themselves. And that's all like really exciting stuff. And I think that, like I said, the biggest part is, we have the data. Everything's right there. We know what these members need, and so it's really a much better way to deliver it. And I'd add that this is, the virtual care is being delivered. I talk about re-delivering it. It's also still, a lot of virtual care is being delivered by that member's own doctor. So we're expanding how virtual care is delivered with the providers in the local community as well.
Yeah, those are important considerations, because essentially what you're saying is you're breaking down barriers, and the barrier to getting to a physician, or being able to make the appointment and get an appointment and get people on the back end to cover for you or take care of the family, or really even a fear of going to the doctor, or catching something, you name it. There's probably a million reasons why people would say, nah, I'm not going to do that today. But breaking down the barriers so that it really is easy to log on and to
So true. So some of the younger generation, like the younger generation coming through, some of them they don't want that solid, that tight relationship that certainly I have with the primary care doctor. They don't necessarily want that at their age right now. They're just looking for care when they need it. And so, we think they should have a primary care doctor, but we're not going to fight that. We're going to try to deliver it where they want it, where they receive it. So yeah, there's a lot of really neat things going on. We've actually begun piloting some virtual first health plans, which are right now just in pilot stage, but showing some real promise and showing some real savings, where the first thing the member does is they see a virtual care provider, and that virtual care provider helps them understand where to go next. And that's like such a common problem, is somebody, cuts their finger and they know they shouldn't go to the emergency room for something minor, but they don't know where to go. And so, giving someone the ability to get to a provider 24/7 and say, what do I do? Where do I go? Like, just that is solving a big problem out there. So yeah, a lot of really neat things going on with virtual care.
Well, healthcare, among many, many, many industries, having to rethink and figure out how to reach people where they're at. And, that's really a strategy that everyone's trying to figure out as we go forward. So let's segue a little bit to open enrollment. You mentioned coming up, and non-traditional ways of getting the information out to, to employees, to employers. So well, first of all, let's assume we're talking to an employer audience at the moment. So thinking about what is United Healthcare pioneering and innovating on top of, some of the things that we talked about, but in this open enrollment period, in this cycle, and if you could speak directly about what you're seeing from a cost management perspective, and, some of the other aspects that really would differentiate United from some of your other colleagues.
Yeah, sure. Great question. Open enrollment, right? Big time for everybody. Everyone's got to make a decision on their health plan. And health care has become so expensive, right? I think the average family plan now costs $20,000 a year. So people need to spend a little time understanding what their options are. That's probably the number one thing, a bit of advice I'd put out there is everyone going through an open enrollment should at least understand the options. If they have any questions or they're confused, like we are, and I'm sure many in our industry offer so many resources out there. So if you have questions, talk to your local HR team. But there's so much available for people out there in terms of us trying to help them understand what is available and what fits their needs the best. So the first thing is make sure you understand your options. Make sure you understand what's available to you and where you can get more information if you need it. Second thing would be, do that under the, keeping in mind what your anticipated medical costs are, right? Many employers are looking to offer more options for their members, right? And if you're a family that has, a lot of medical needs, then you may steer towards one plan. If you're a young person with hardly any medical needs, maybe you're steering towards something else and your needs are different. What you look for in a health plan is going to be different. So a lot of employers are offering more plans out there. And that just means people really need to be aware of what it is. Anticipate what you need, see what's available to you, understand the information out there. I think I read a survey recently about people spend less than 1 hour making a decision about their health plan. And you think of $20,000 at stake, and they're not spending the time, that much time to make that decision. Make sure you're looking through everything you have to do it. I think employers are trying to focus the same thing. Like they want to make this is an employee benefit. They're spending a lot of money on it too. They want to make sure that employees are getting something out of it. And I think maybe a shift we're seeing, and I know one of the things we're really focused on is healthcare is really expensive. We talked about $20,000. The benefits that members get, even though they're paying all that premium, still there's some high deductibles. Maybe they have a $2,000 deductible, so they go and they seek care, and they're still having to pay a lot out of pocket. People are not always satisfied with the plan they're getting from the industry, and so we're looking for ways to improve that experience. Right? How do we keep people engaged about making the right decisions about their healthcare, but at the same time, how do we help them have a better experience? How do we give them maybe a better benefit when they need it? So we're doing a lot of things out there. We're partnering with companies like Peloton I mentioned earlier, or Apple Fitness. We're giving free subscriptions to our members for those things. We have a weight loss program. We have a program where if people walk, we'll actually pay them money they can use to pay off deductibles and things like that. We have a unique program called Care Cash where members can get money on a preloaded debit card to actually pay for care if they make the right decisions. So we're trying all sorts of things to say, how do we give people better benefits when they need them, but still help them help make sure that those benefits are affordable. So a lot going on.
Yeah. Who do you think makes the primary decision relative to healthcare benefits? Are you seeing a growing chorus of the employee base having a greater say in what the employer chooses for a benefit package, or do you see it still mostly residing within the CHRO or the CFO or the CEO?
A couple things. One, clearly, the employees out there, as the workforce has changed, have a little more say in it, right? They want better benefits. We're seeing much less cost shifting to employees. Over the last 10 years, every time rates went up, employers, the technique was they just shift more cost, increase deductibles and things. So we're not seeing that nearly as much as we used to. In fact, we're seeing some people go the other way. And so that's kind of one thing. The other thing is, as we're having discussions with employers, they're much more aware about it. What are the benefits? How does it work for our employees? Not just, again, like I said before, it's not just check the boxes. How is this really working for our employees? We're looking at a lot more data. We have access to a lot more data to help employers make those decisions. There's a lot more discussion about health equity, right? We're looking at, a big chunk of employees not making as much money as other employees, and looking at, we need to make decisions for all the employees within a company, not just for a select group. So we've seen a lot more discussion about that as well. And overall, that has definitely swung back to employers saying we need to make benefits richer at times, not just keep cost shifting.
Yeah.
And,
So,
and looking to us for innovations, right? So they're coming to us, not just United Healthcare, but the industry to say, we need your help. We need innovations. Things are changing, and costs keep going up, and members want better benefits. How do we connect those things? And it really, for us, that innovation side really falls into three things we're focused on. It's how do we improve the care members getting, how do we make it more affordable, and then how do we improve their experience? And those are really difficult things to pull together, but we've got some really innovative things we're working on. We've got a new health plan that we've rolled out across the country, available here in Rhode Island, and trying to expand access to that. It's called Surest. It's got a brand name to it. It was a company that we actually invested in early on and saw such promising results, ended up becoming part of United Health. And it's a really unique health plan. It's completely different than kind of what we've seen as a traditional plans. And I kind of call it a point of care decision health plan. It's got no deductible, no co-insurance. Everything is just a copay. And when members need care, they have an app, or they can call the health plan, and we'll help walk them through. But everything is copay driven, and there's really two cool things in my mind about that. One is it's copay driven, so there's no deductible, no co-insurance. They get care from dollar one almost, so that's good. And the other side of it is they actually know what they're going to spend before they get care, right? Like Eureka. So many times someone goes and gets care and they don't know where the bills start coming from. They have no idea what it's going to cost. The provider can't tell them. Well, this plan actually does an episode-based cost copay. So members, when they go to get care done, they'll know what that copay is for everything that happens during that episode of care. Whether it's a knee replacement, an office visit, an MRI, whatever it is, they can see that. And what they do, their copay is driven by where they get that care, who they get that care from. And we're trying to steer members to providers that have the highest quality outcomes at the most efficient setting. So they'll see maybe a different copay if they're going to have something done in a freestanding setting versus at a hospital. And woven into that is our kind of push towards quality and better outcomes and evidence-based medicine. But trying to get members to the place where they're going to get the best outcome at the most efficient price, and do it through a copay. And everything is covered through a very traditional out-of-pocket maximum. So there's a maximum they're ever going to pay on those co-payments, but really unique. We've seen a lot of promise, as do most of our things. They start with some very large employers around the country, and we're seeing that come down to smaller and smaller, and available in Rhode Island today on a self-funded basis. And we're beginning around the country to roll out on a fully insured basis too, and just make it more available. But that's really exciting because it's completely different than how people have seen us in the past.
So we only have 2 minutes left, but I did want to touch on the provider landscape in Rhode Island and ask you a little bit about what the United Healthcare view is of the hospital industry and the stresses that each of the major systems is encountering today. Where do you see that discussion going?
There's a lot of stress. There's a lot of stress in the system, right? The pandemic and all the other inflationary pressures and the workforce pressures that are hitting all of us are hitting the provider industry. And so there is a lot of stress. The positive side of it is how we're dealing with that stress, and it's not always going to be perfect between the healthcare industry and the providers, but how we're dealing with that, I think, is taking on a new light. It's no longer about just a negotiation of a price. It's much more about how we deliver quality, how we focus, how we work together on improving how that care is delivered on a quality basis and on an efficiency basis. And those are, I think, some of the really promising discussions. You've heard of this, accountable care discussions. And actually, Rhode Island, we rolled out one of our very first ACOs, accountable care organizations, across the entire country. One of the first ones was right here in Rhode Island years ago. And we're doing that, those kinds of contractual discussions are happening with more and more providers. So more and more of that discussion is how do we deliver this better care together? And how do we try to deal with those stresses together, as opposed to just what's the rate and what's going to happen there. And I think we're doing a really good job of that. We as a company, United Health Group, we have a whole division that works with just providers and how they can do that and how they deliver that, better access to care, higher quality care, more efficient care. So those learnings are really transcending across our entire organization. So when we're working with providers, it's not just about, hey, you got to deliver higher quality care. It's like, how do we work together to help you get there? How do we give you data to do that? So there's a lot of stress, but I think the promise is we're working together to cope with those things.
We've been talking to Eric Swain, Vice President of United Healthcare of New England. We've been talking all things health insurance, healthcare innovation. We've covered a lot of ground, lots of interesting things that are developing on the scene as a result of, getting past the COVID situation. Although we are not completely past it, it's become the endemic, as we all know. But a lot of things that you mentioned, Eric, around the greater desire for employers to actually offer richer benefit packages and the ceasing of cost shifting, I thought was really a very interesting development that you're looking at. And essentially, what you told us is that open enrollment for the plans is coming up very soon, and the most important thing that an employer and an employee can do today in advance of that is to really know what your options are, because it is not one size fits all, and there are so many different plan configurations based on your own needs. And there's probably a plan out there for you based on what you or your family or your health experience is. And again, lots of new modalities of ways to access the healthcare system, whether it's virtual or whether it's different kind of plan design and the like. So I'll let you have the last word, Eric. Anything you want to leave us with?
Sure, and I'll go with what you just said. Make sure you engage. I would say the best thing members can do now is engage with their health plan digitally. Go into that digital front door. There's so many things available for you to help be a better purchaser of healthcare, to understand healthcare better, and to get the most out of your health plans. So engage digitally. Go into that front door, and it'll be a much better experience and a lot of help to engage with the system. And thanks so much, Laurie.
You're welcome, and we will see you again, Eric, and look forward to seeing you in real life at some point.
Sounds good. Take care.
Take care.